Very good. Thanks for joining us for the daily update. Joined by the Minister and also Tony Walker, the CEO of Ambulance Victoria, who's happy to take any questions in relation to some of the updates we're going to give you. First things first, though, we have 8,181 coronavirus cases in Victoria. That's 459 more than yesterday. There are 228 Victorians in hospital and 42 of those are receiving intensive care. I'm very sad to have to report that there are now 71 people whose lives have been lost because of this virus, 71 people whose lives have been lost because of this global pandemic. That's an increase of 10, 7 men and 3 women. The 7 men range in age from their 40s to 80s. There is one gentleman in his 40s and 3 women in their 70s and 80s. The Chief Health Officer released later today will have further details to the extent that that is appropriate. Of those 10 fatalities, 7 are linked to aged care outbreaks and 3 are not linked to an outbreak. We'll provide further details to the extent appropriate later in the day. We of course send our condolences and best wishes to those families. This will be a terribly difficult time for them and they are in our thoughts. We have conducted a total of 1,500,519 tests. That is 42,973 tests yesterday. That is by far and away the biggest testing result that we've seen on a single day. If memory serves, I think 37,000 is around the number that was our previous peak. That is a very impressive effort and we're very grateful to each and every Victorian coming forward and getting tested. That is critical to tracking this virus and then being able to contain it. There's 4,233 active cases. Just a couple of other issues. There are some 560 active cases in aged care. The exact number of settings will be finalised in that release later today. And we have some 381 active cases among healthcare workers. That is a significant challenge given whilst we have overall capacity and we've worked very hard all throughout the year to grow the number of people that can be available for our fight against this virus in a clinical sense, whenever we have clinical staff and other critical health workers away, furloughed because they're a close contact or in fact as an active case, that does put some additional pressure on our system. That's why we're looking at a whole range of innovative ways to grow the total capacity of our health system. It's not just about ordering the equipment that we need, so gowns and gloves and masks, machines to help you breathe, patient monitors, actual beds, mattresses, all of those things. That's a feature of the ordering we've done over a long period of time, but it's also looking to be as creative as possible. So the reason Tony is here today, and he can speak to this if people have questions of him, we have some 200 Ambulance Victoria off-roster paramedics and third-year students who are helping us with contact tracing, their clinical training, their skills in terms of dealing with dynamic and complex circumstances mean they're perfectly suited to that. That number may in fact grow over time. We have 20 ADF personnel who from tomorrow will begin their training with Ambulance Victoria to work alongside Ambulance Victoria paramedics in joint crews. That'll scale up over the next 8 to 10 days to around 150 ADF staff, so essentially freeing 150 Ambulance Victoria paramedics to do other tasks and also, I suppose, getting ahead of any potential furloughing or any potential quarantine that has to happen because of any positive cases across our Ambulance Victoria workforce. I hope that's seen as a particularly innovative way of putting the best skills to the best use and making sure that we protect our paramedic workforce as much as we possibly can and have them performing any and all roles that they're uniquely placed to undertake. I think it's of particular note the number of paramedic students, the number of off-roster paramedics who might have a work cover issue or might be pregnant or for whatever reason can't be on the road, to have them working in our contact tracing team, our public health team more broadly, is very much valued. And of course, Tony, we'd ask that you send our thanks back to all of your workforce for the amazing contribution they make every hour of every shift, and particularly at times of really great challenge which we're experiencing as part of this global pandemic. More broadly, there are 16,000 dedicated members of our health workforce who've expressed their interest in working on our public health response and our clinical response in hospital settings. There are about 4,000 current and retired nurses and midwives, for instance, who wouldn't have normally been involved in many of the tasks that are made necessary by this pandemic, but they've put their hand up to be part of that. And through Working for Victoria, there is around 800 health professionals who have indicated that they are prepared to work. They have already been deployed, sorry. Those 800 are out there doing all sorts of different tasks as part of our public health response, part of our clinical response to this pandemic. So I suppose the point to make there is that we've got people right across the health system putting their hand up, putting themselves in harm's way, many of them, running the risk of becoming infected. They're playing their part. That is a particularly impressive thing, and that is again another reminder that we've all got to play our part too. They are not frontline workers. They are the last line of defence against this very, very infectious virus. They're all wearing masks. We need to do the same, and I'm deeply grateful to all those Victorians who are. It's very impressive to see so many people. It makes you proud to see so many people wearing masks right across the city. And particularly in regional Victoria too, where it's not compulsory, but where if you can't maintain that 1.5 metre distance, it is something we're asking you to do. And my reports from lots of colleagues across country Victoria, that's happening, and that's a fantastic, simple but a fantastic step that we can take, powerful step we can take to try and curb the spread of this virus. Beyond that, before we take questions, I just wanted to reinforce a couple of important messages. If you are sick, then you must get tested, and you must get tested quickly. Then you must stay at home and wait for your test results. Not going to work, not going shopping. That's what I'd ask of you. It's a simple thing. There's a $300 payment available for that period if you're in insecure work between getting your test and getting the results. If you are positive, there's a further $1,500 payment. We know that insecure work, casual work, people who, if they don't work the shift, won't get paid, they don't have sick leave to fall back on, is driving a lot of people to perhaps ignore or put to one side the fact that they've got a runny nose, they've got a scratchy throat, they've got coronavirus symptoms. Hopefully those payments and continually getting these messages out to people, and we're doing a lot of this work right across the board, using every platform available to us, making sure that the messages are culturally appropriate, language appropriate. It is very, very important. If you've got symptoms, get tested and get tested quickly. Wait for your results at home. Don't go to work. Don't go shopping. Don't leave your house. That's a really important and powerful contribution that everybody can make. And if we do that, together with all the other restrictions we have in place, and particularly the universal wearing of masks, which, as the Chief Health Officer has indicated, is essentially our stage 4, that will start to see not just the stability that we seem to be enjoying at the moment, but it'll start to drive numbers down as that R0 number, the number of people that each positive case infects, rather than everybody infecting at least one other. That's an R0 of 1. Then if we can drive that down, then only every second or every third positive person will infect somebody else. That's how we'll see numbers decrease steadily over time. I think that is essentially all that I had in terms of daily reports and some other important points to make. And now I think we're happy to take any questions you have. I'm not quite sure what you mean by that.
I've seen a lot of feedback from families of aged care residents, families in the fortnight, that they've had no communication that they still cover from the BHS and the
well, let me be really clear with you. As I announced yesterday, a long and detailed list of steps that we're taking in partnership with the Commonwealth Government, and again we're grateful for that partnership. That's a recognition that this is a sector that is regulated and run by the federal government, but there's no lines to be drawn here. We're all working together. As for how individual operators, individual providers of aged care, obviously they have to be accountable for what they have or haven't done. I'll make no comment on that individual nursing home, but any time there is a death, then there's the potential of the coroner looking at that, and of course that would be entirely a matter for them.
10 deaths is obviously our most deadly day so far.
Correct.
Is it also the day of youngest death, the man in his 40s?
I believe that is the case, yes. We'll have further information for you, the exact details of whether that person had underlying health conditions. We know that they were not connected to an outbreak, but part of the challenge here is just making sure we've got all the best data, that we've spoken to family, that we've got permission to speak in anything beyond the age and gender of that person. But as soon as we can, if we can, then through that Chief Health Officer release. 42 people who are in intensive care at the moment.
But it sends a stark message to those who are still maybe not wearing masks that somebody in the field did that.
Yeah, well, we've said all the way along, and not because, not for any other reason than the international evidence. The facts of these matters show you that this doesn't discriminate between age, doesn't discriminate on gender, doesn't discriminate on any basis whatsoever. It's a wildly infectious virus, and if you whether you have underlying complex health issues or whether you are otherwise healthy, people have died from all of those cohorts and more from right around the world. So there's no reason for anybody to think that because they're otherwise fit or because they're not in their 80s, then somehow they've essentially got a vaccine for this. They just don't. Everybody is susceptible, and I'll again remind you about some of the growing international evidence that the Chief Health Officer and others have spoken to about many people. This is not like a common cold where a week or so later everything feels fine. It presents in many, not all, but in many, as much more like a chronic illness where it takes quite some time to get over it. This is not something anybody wants to get, and it shouldn't be something anybody wants to give to anybody else, and that's why wearing masks, and it is the vast majority of people are doing that, and I'm very grateful to them. The vast majority of people are staying at home. They're only going out when they need to for the things they need when they need them. But I think the key point to just keep on making, and we saw some of the numbers last week, if you've got symptoms, you've got to get tested, and you've got to get tested quickly. It's more than 160 sites across the state. We're doing thousands and thousands of tests every single day. We get the results back as fast as we possibly can. It's around a 2-day wait. There is that income support if you didn't have sick leave to fall back on. Then while you're waiting for your test, you've got to stay at home. You can't be going out to the shops. You can't be going to work. All that'll do is spread the virus. And what we know is we see, not as a matter of anecdote, not as a matter of opinion, it's what the data's showing us. Aged care, health care, big distribution centres, abattoirs, meatworks, cool stores, big warehouses. These workplaces are driving most of this second wave, and therefore what that tells you is that some people, for whatever reason, it's not a matter of judgment, it's just a fact, some people are feeling sick, they have symptoms, and they are still going to work. And if that continues, then we'll just continue to see more and more cases.
You said it's a 2-day wait, but I personally know people who are currently waiting 5 to 5th day now. What's the reason for that? And obviously 40-something thousand tests is much higher than I think the near 30,000 we could handle in this state. So are we just going to see more blowouts, or are we getting help from elsewhere? Or I suppose, I mean, how do we quantify those test numbers? How many were from the last 72 hours that you've listed before?
Yeah, so every sort of 4 or 5 days, if you look back and have a look at the trend, we've seen a large number come through, and that'll be about backlog, if you like. So this is about results that have been processed. That is a very substantial number. We've been running close to 30,000 a day for quite some time now. We get some support from private laboratories. We get some support from interstate labs also. Everyone's doing their very best, and the average time is around that two days. It doesn't mean that every single sample will be back within those 2 days. Some will take a little bit longer, but that's why we've been a bit conservative and said the $300, which we think is more than just 1 day, more than 1 day's pay for most people who would be in that insecure work and who might be making that decision to go to work to get paid rather than being out of pocket. The laboratory technicians are doing an amazing job. Many hundreds, perhaps more than that, staff at testing sites are doing an amazing job as well. But the key point here is if you've got symptoms, you've got to come forward, you've got to get tested as quickly as you possibly can, then stay at home, don't go to work, don't go shopping. We'll support you in any way that we can, and we'll get your result back as fast as we can also. But we just can't have people going to work for whatever reason while they've got a runny nose, a scratchy throat, headache, fever, all of those things that are warning signs that you've got this virus. And even with universal mask wearing, if you're going to work, you're just an unacceptably high risk of spreading it to co-workers, to lots of other people, and that's why we're seeing significant outbreaks in lots of different workplaces.
Do you think we're on track to...
Laurel, you can be next, Vic.
Groups of hundreds of WorkSafe and police people
Yes.
going around to workplaces.
Correct.
A week ago. What's been the fallout from that? Has anybody been fined? What's the general compliance across the work?
Yeah, I don't have a report, Laurel, on the work that's... I know there's a power of work has gone on. I haven't got a report back on results. I would think there won't be too many fines issued because I think most of these employers, these big, often very large employers who are well and truly at the centre of the outbreaks we've seen as part of this second wave, I think they know and understand they've got to be taking steps. I think that many of them are, if not all of them. It's always just about double-checking, triple-checking, making sure that they've got all the right processes in place. I think probably tomorrow we might be able to provide you with some further details of that, and if I can, I'll be more than happy to make that a feature of our briefing.
I mean, most Victorians are wanting to know whether Victoria is still on track to end the 6-week lockdown. Do you think that's achievable, or are we looking at eventually, given the high numbers, a longer period of lockdown?
Well, look, what I'd say is these things change rapidly, but you'd have to say that these numbers are far too high. Whilst there is some relative, and I stress the term relative, stability, we're not seeing a doubling and a doubling again. We're not dealing with thousands of cases a day, which is what the modelling tells us we would have had to deal with if we'd not gone to the stage 3 stay-at-home orders. We've got to drive these numbers down. And whilst the vast majority of them can be traced back to an outbreak, not necessarily on the day that we report them, but once that investigation, that contact tracing is done, it's very clear that the vast majority of these are directly attributable to a known outbreak. Even with that, if you were to reopen now, say, then we would not be dealing with hundreds of cases a day. We would, just because of movement, because of chains of transmission, we'd be dealing with many thousands of cases per day. We are approaching the halfway mark. We've been clear that it would get worse before it got better, that stability had to be achieved before we'd start to see numbers fall. The fact of the matter is, John, I can't tell you where we're going to be in another 3.5 weeks. But what I can confirm for you, for your readers, for every single Victorian, is that the data will drive the decisions. The advice from the Chief Medical Officer, Chief Health Officer, and indeed the Chief Medical Officer at a federal level, so public health experts, will provide us with advice on what next steps should be. And we'll follow that advice because we've got to be led by the data, the science. We've got to get this right. And I've said a few times, John, you know, a day in this is like a month, and I can't predict where we'll be tomorrow, let alone with any certainty give you a sense of where we'll be in another 3.5 weeks. However, I would just say we will get to the end of this faster if we continue to see the amazing effort that is so noticeable across the city, people wearing masks, traffic data that represents people being at home, all the other evidence that we gather that says that the vast majority of people are doing the right thing. We're deeply grateful to each and every one of you. It is making a difference. We've just got to go that extra bit to make sure that we're not just bringing stability, but that we're driving these numbers down. And going to work when sick, or going out to the shops while you're waiting for a test result, that's a big driver of this. It's not exclusive, but it is a substantial driver of workplace outbreaks.
On those precarious workers, they might even announce the $300.
Yes.
While waiting for a test, $1,500 to cover a fortnight. But a lot of these people are also worried about permanently losing shifts, so it's not just about losing, money for 2 weeks.
Yeah.
How do you ensure that employees who test positive to COVID aren't penalised permanently?
Well, I don't know whether... I'm not for a moment diminishing that may be a concern or a fear for some people, and I don't know whether that's driven by evidence or whether it's just a sense that they might have. I'm happy to have some more work done on that so we can better appreciate that challenge. I'm not sure that we can do much more than provide financial support during the period when the person is not working the shift and therefore not getting paid. That is over and above what others are doing. We think that's the appropriate thing to do. Beyond that, though, we have very detailed discussions with large employers, with labour hire companies, almost daily, trying to make sure that, further to Laurel's point before about those high-risk workplaces, that people are doing the right thing. As far as speaking to some of the leaders in that casualised workforce, so labour hire companies, for instance, we've got very good relationships and speak directly with them often. I'm more than happy to make sure that a feature of those discussions over the next few days is just a reminder that whilst people may be sick for this period, whilst people may be away because they're doing the right thing by all of us, my expectation would be that they'd be able to return to work and they would continue to be a valued member of the team once they had got either over their ISO because they were a close contact or over their positive diagnosis.
How much work is being done today? We've obviously been in the pandemic for 6 months. Workplace transmission has been an issue for government since mid-May.
Correct.
How much work are you putting to actually knowing, finding out whether permanent penalisation of working conditions?
I think, Samaya, we've been far more focused on the pandemic than a much bigger issue, which is, I think, a structural weakness in our economy that has been very graphically exposed. Insecure work is no good for public health in terms of dealing with a global pandemic, and there are many other attendant challenges. And I've said a few times now's not the time for us to be having a debate or a discussion about that. But out of this pandemic, there are many, many learnings. One of them is that insecure work, the notion of not having that connectivity, the basic entitlements that all of us in this room enjoy, that is a real challenge, not just for public health, but a challenge for providing for your family, for stability. That's something that we have to return to, not just as Victorians, but perhaps at a national level once this is over.
It's very possible to sort of it's impossible to disassociate the casual workforce and the second wave in
Yep.
Victoria with insecure work.
Yep.
So I guess my question is, how much work have you done around permanent penalisation of employees who test positive to COVID, not staying home because they're worried about permanently losing shifts?
I think I've answered your question, Samaya. We are focused on supplementing and replacing the income that those people would lose. We've not done an enormous amount of work based on what you're putting to me. I'm happy to have that followed up. Ultimately, no employer should be discriminating against anybody, least of all discriminating against someone who's doing the right thing by every colleague and by that particular business. No business wants to be shut down. No business wants to be becoming particularly famous because they've got an outbreak in their particular setup. This is I suppose you're asking me, in one of the consequences of this, you're asking me to kind of have dealt with that before we've dealt with what's driving it. It's not unimportant, but we're far more focused on the most pressing issue, and that is trying to supplement the income, to replace the income that those families will not get because they don't have sick leave. They don't have a safety net that they can fall back on. If they don't work the shift, they don't get paid. But now they don't have to work the shift. They can get the $300 payment, they can get the $1,500 payment. That is direct support. That's where our focus has been. The broader issues that are thrown up as a result of insecure work, we should all come back to those. We absolutely should, because that's been exposed during this global pandemic as a really bad feature of equity and fairness right across our state.
So even in the masks, we're seeing people refuse to wear them when they try to go to Bunnings. They're reciting from a script almost. What do you think of that behaviour? And can you clarify exactly what rights people have? Do they have to show police their ID? Is it a question of law? How does that change for the Chief Health Officer's ruling?
Well, the Chief Health Officer under the Public Health and Wellbeing Act makes orders. Those directions need to be followed. If they're not followed, then police are able to fine you. It's a $200 fine. It should never ever come to that. If it's a genuine error, if there was a sense of any confusion, police use good judgment. They're about trying to be as fair as they possibly can be. But if you're just making a selfish choice that your alleged personal liberty, quoting something you've read on some website, this is not about human rights. Well, there's 10 families that are going to be burying someone in the next few days. Wear a mask. It's not too much to ask. And what's more, the nurse who will be treating you or a loved one, they'll be wearing a mask. So you wear one to prevent that nurse from having to treat more patients. It can't get any more serious than that. The 10 families are currently planning funerals. And the youngest among them, they've lost someone in their 40s. Please wear a mask, everyone. And if you don't, you'll get fined. And that's exactly as it should be.
Given the number of cases that are now linked to aged care outbreaks and the record number of deaths per day, how many deaths does the department want to predict over the next week? Do you expect the death toll to rise significantly?
I think the Chief Health Officer has been very clear that when you think about the average age in these sorts of nursing homes, these type of aged care settings being around 90, many underlying and complex health conditions, whenever you see an outbreak in aged care, you will see people sadly die. As far as modelling beyond that, I'd need to get someone from the public health team to come back to you. I would just, again, I haven't got the bit of paper in front of me now, but I went through a list of different things that we're doing in partnership with the Commonwealth Government as a recognition of this is a shared challenge, but no state government can do this on its own because the system is not actually governed by us. It's not a system that's paid for and run by us. We have a lot of public sector aged care, but private sector aged care, whether it be for-profit or from the church and charitable sector, we need to be working with the Commonwealth, and we are. And whether it's universal PPE wearing, trying to change rosters and actually delivering that reform so that workers are only working in one aged care facility, not moving between aged care facilities, testing and standing up, if you like, a really dedicated focus within the State Control Centre. I think everything that can be done is being done, but not to cut across the very first question, which was the response and the behaviour and conduct of individual nursing homes. I'm afraid I can't speak to that because they are private businesses that are not accountable to us. But that's why working together is really very important. If there's any further data I can provide you, then I'll get the public health team to do that.
Are you happy though with, are you comfortable, do you have vision, I suppose is probably the thing, do you have vision of what is actually going on in the aged care sector? Or
Yep.
is it because it's a largely federal responsibility, you don't have actual...
No, John, don't interpret anything I've said to mean that we don't know the circumstances and the way that individual nursing home providers are acting. We've got clear line of sight of that, but our role and the responsibilities we have are around public health. How the facilities manage beyond that, that's not really a matter for us. That's why, just to give you, I suppose, probably the best example, there's a lot said and many people have very firm views on if there's an outbreak in an aged care setting, everybody should be moved out of that aged care setting. There's a couple of points there. This is a person's home and they have the right to have a view about where they want to spend that final chapter of their days, COVID or no COVID. There's also judgments that are not made by me, they're made by treating doctors about whether the aged care facility can appropriately care for that person, whether it be in terms of clinical care or infection control. Shared bathrooms, for instance, that person would need to be moved out. That would be a completely unacceptable risk. And the third point, which is just a fact, it's not a reason to do anything, but it needs to be acknowledged that whenever you move aged care, particularly very frail aged care residents, it can be a very traumatic and sometimes tragic process. And we know that. Whenever we upgrade an aged care facility, we need months and months of time to lead into that, to appropriately manage a group of people for whom big, profound change like that can be very, very, very challenging. The important point here is even though we don't run these aged care homes, we are working incredibly closely with the people who do, and I want to give Minister Colbeck a shout out, Minister Hunt, and indeed I've had conversations with the Prime Minister about this as well, and I think that the response that's being delivered in aged care differs in many ways to what occurred in the first wave in other states. We've learnt from some of the tragedy that came there, but it is very challenging. And whenever we get an outbreak in an aged care facility, that's a very serious issue for us.
This is focused today on the last line of defence.
Yes.
What kind of influx on the health system you're expecting kind of the coming week, and is there scope to scale up further? Given, I guess, what we're looking at?
So I suppose if I take you back to the numbers I read out off the top, that's 16,000 people that have put their hand up to play a role. There's about 800 that we've already deployed, so there's a pretty significant reserve force, if you like. But we know that as each and every day goes by, we will see more and more health workers that test positive, others who will be close contacts. To give you an example, we had the Northern Hospital at but a fraction of its overall capacity. They've now more than 100 staff came back, I think, last weekend or early this week. So it'll come in waves, but that's why we trained up additional staff months ago. That's why we're working closely with the private sector. That's why we sadly have had to cancel some elective surgery in those higher categories, the less urgent or less time critical categories. And that's why we're doing some really innovative things we've never had before. Ambulance paramedics working alongside ADF or anyone else for that matter that weren't part of the Ambulance Victoria family. That's just using common sense. If you can work together, then you can free up other resources, or you can deal with the sort of absences that we may see. We're not seeing a massive problem there now, but that may well be a feature of this second wave as it continues.
Can we ask Tony about
You absolutely can. I was kind of leading you there, Tony.
Sorry. Joys of glasses and masks. Yes.
Tell us how this is going to work. What are the exact duties that the ADF officers will be performing while they're in an ambulance with paramedics?
So first up, we've been planning for this since January. So we've had plans underway that have involved working with, for example, our 1,000 first responders around the state to ensure that they're available to us, working with the non-emergency sector. We've got partnerships with Lifesaving Victoria, partnerships with the SES, for example, St John Ambulance, and ADF are part of that broader planning approach we've had. So with the ADF, essentially what we're doing is onboarding them commencing tomorrow. So they'll be trained up to complete the same first responder program that our normal community first responders complete in country Victoria. That includes driving and includes, importantly, a very, very strong focus on personal protective equipment to make sure they're protected and safe in doing the role. In the event we have to deploy them to support our paramedics, and we're hopeful we don't. We're hopeful that the community will do the things we want them to do, which is obviously wearing masks, staying at home, doing the things that the Premier was talking about before. But if we do, that they're available to help us to either drive an ambulance from the scene back to hospital, to carry equipment in and to support our paramedics in delivering clinical care. And one of the great things, we've worked with Defence closely, particularly during the bushfires, and the relationship we found working with them was phenomenal. The partnership and the ability to work together, nothing was too much trouble for them, and we find that the nature of the military approach fits in nicely with the same approach that we're taking in supporting care in the community. So we're looking forward to commencing that induction and training, and as I said, I hope we don't have to use it, but they're there if they need to, together with all the other partner agencies that we've been working with.
So they won't be actually treating patients per se, that we're doing all the support logistics stuff?
That's correct. They won't be involved in direct patient care. They'll obviously be supporting our paramedics in providing that care, but particularly around carrying equipment, driving back while the paramedics are delivering care, moving stretchers, those type of things, just allow the paramedics to be freed up to deliver that frontline care.
How has the ambulance service been impacted so far by staff having to go into isolation and things like that? What kind of impact is it having on day-to-day operations?
So far we've been fairly fortunate. We've currently got around 60 staff who are furloughed, either as a result of contacts or majority of cases, people who are doing the right thing and wake up in the morning with a bit of a scratchy throat and not coming to work. So that's the first thing. We're also seeing a really strong focus of paramedics who are sorry, just my train of thought there. So they're the ones that are furloughed. The other group that we're sorry, can you just ask that again? Sorry.
What kind of impact are you finding
Yep.
so far from staff?
Yeah, sorry. So besides the group that are furloughed, we're seeing a reduction in overall demand at the moment. So we're seeing a demand for our services not as high as it's traditionally been. Now, we have been out quite strongly over the last few months to make sure that people are calling us for the things they should still be calling us for, particularly things like heart attacks, strokes, etc. So, but our demand is slightly down at the moment, but our overall time to do a case is much longer. So, for example, our paramedics, because of putting on their PPE, the requirements to take that off in hospital, the cleaning of vehicles, the overall case time can take longer. So overall, we're tracking probably about what we were pre-COVID in the sense of how we're responding to the community. But the reality is that we just need to see an increase in demand and it will have a significant impact on us, which is why we're wanting to make sure we've got the resources in place. But importantly, we've also got the capacity to be able to ramp up if we need to. We look overseas to places like London, we look over to places like New York, etc., where they've seen exponential growth in ambulance service demand. We're prepared for that. We hope we never get to the position to have to respond to that, but we've got all the resources in place to be able to do so.
When the partnership with the ADF was first announced, the union was fairly nonplussed, said it didn't really know how it was going to work. Are your members on board with this?
They're supportive of. They understand that this is a natural consequence of if we're overwhelmed by workload, that we have to be engaging different agencies to help us deliver care. And certainly we don't want to be in a situation where we're scrambling at that time to try and find the people to be responding with us. So the union are quite upfront with us about the fact that they're wanting to make sure we exhaust our internal resources first, which we clearly will be doing. We've recruited an additional 120 paramedics. We've got the additional students that we've onboarded as well, the Premier spoke about before. So our goal will be to use them before we have to use the defence, but the defence are there and ready to go. And the union are very, very supportive of it. I've had a number of conversations with Danny Hill from the Victorian Ambulance Union about this, and he's fully on board, understanding, of course, that it's about the worst case scenario, which I come back to. I hope we never get to. I hope if people do the right things, as we've been talking about today, we won't be in a position where we need to activate these things. No, I'm not the person for that one.
Yes.
Figures that I'm looking at, around about 3,000 cases are still under investigation. How long is it actually taking us to move through each individual case to make sure that we're not doing the first initial interview after 24 hours, then contacting those close contacts to make sure they're isolated?
Mark, I'm not sure where you get that figure from in terms of active cases that are under investigation. Obviously, we report to you each day the number of cases based on that group. So say today, I don't actually have a number, but I think it's in the order of, there's about 80 of those 459 that are connected to a known outbreak and the balance aren't. So that's a number in the order of about 360, 370, 380 maybe. Basically, then after the initial interview, that interview that's conducted within 24 hours, and again, people would have seen on the news last night, and we spoke about it yesterday and I think the day before, ADF out with authorised officers from the public health team, door knocking those who had not answered their phone, door knocking those who for one reason or other we were not able to make contact with them. And I've made the point again, it's not about judging those people. If you make 100 phone calls, chances are you're going to struggle to find a number of those people answering their phone and in a position to be able to talk to you. That's really important work, and that'll just mean we can get to each and every case for that initial interview quicker than we otherwise would. Beyond that, though, contact tracing of close contacts, not the initial interview, but those who are positive, but the contact tracing and the home ISO for those who have spent time with those positive cases, that's always a massive challenge. I've made the point a couple of times now that whether it be trying to get gowns and gloves and masks and ventilator machines when the entire world wanted it at the same time, that's always a challenge. Any health system, if you finish up with kind of thousands of cases a day like we see in other parts of the world, any health system will struggle to cope with that. And when you have thousands of close contacts to follow up every few days or so, that's a really significant challenge as well. That's why there's well more than 2,000 people in there. It's why teaming and tasking with support from the private sector, from ADF, from Ambulance Victoria, as Tony just alluded to, it's a big team. I can't rule out that it gets bigger still because the challenge is getting bigger. And that's why we're so grateful to all of our partners. The other thing, and you won't see these people, they're not in uniforms and they're not even in our state, but we've got significant public health expert support from call centres in a number of other state capitals, and we're very grateful for that. That just means you can make those calls, whether it be the initial interview or follow-up phone calls, emails, text messages, you can reach out to people. The biggest message today, though, and most important message, is if you've got symptoms, then please get tested and get tested quickly. And then stay at home until you get your result. And if you're positive, then you have to stay at home for those 14 days. If you need further support, we're there to provide that for you. But workplace outbreaks happen when people, many of whom perhaps their symptoms are so mild they don't know. But we do know that there are people who have symptoms, and for whatever reason, and it's not about judgment, it's a fact, they're going to work. We have to stop that. We've got to drive that number right down. Some of the announcements we've made in relation to financial support are aimed at doing just that, and the broader messaging. And Samaya, if you've got examples, for instance, of any worker who fears for their long-term employment because they've done the right thing, please provide those to our office, and I'm more than happy to follow up with those employers. No one should be penalised for doing the right thing, protecting their family and every family, and indeed protecting that workplace from an outbreak that will come at potentially a very big health cost, but also a very big economic cost as well.
We're a long way off. We're a long way off from a situation where the health hospital system becomes overwhelmed.
We would need to see thousands and thousands of cases. That's not for and on the modelling, on the data, on the view of the public health team, the restrictions, the great collective effort that everyone's putting in will mean that we most likely avoid that. But that's not to say that it's easy in our hospitals at the moment. Winter is always a very challenging time. And I think Tony's just given you an example where you might look at the raw data and say there are less call-outs, but every single call-out is very different with putting on PPE, taking off PPE, all of those sorts of issues. So, look, there's some pressure there, there's some challenges there. We think that our resourcing and our planning is equal to that challenge, but again, we're so grateful to every member of the team, clinical staff, those who support our clinical staff, and if you honour their work, if you genuinely rate the care and compassion and the skill, the courage of these people, wear that mask, stay at home, don't go to work if you're sick, get tested if you're sick. It's the only thing to do. For whatever reason, to avoid a fine, to get this second wave over quicker than it would otherwise be, or to thank our health system heroes. I'm not too fussed what motivates you, but for all of those reasons and many more, please do the right thing.
Sorry, I appreciate
Yeah, to follow up, sorry, yes.
I appreciate it's a challenge, but how long is it taking us to get onto the close contacts of people after they test positive and the department knows about it?
I'd have to get the public health team to come back to you on that.
Do you have any figures on
Economics of the aged care, what do the economics of the outbreaks at aged care facilities and also high risk settings reveal?
I don't have a report on any genomic testing.
As in, are they linked to, for example, Orange State?
As I said, I don't have any genomic testing. I've no genomic testing that I can speak to you about. I'm happy to put that request to the public health team.
Do you have any figures on how many doorknocks you gave from announcement Friday, and are they finding people at the moment?
I think we'll need to get someone to come back to you on that. I'm more than happy to get you as definitive a number as we can. They're certainly out there in force. I think by the end of today they were looking to have 28 teams, so several door knocks an hour. That's a very significant workforce. We've got about 20% of people who for one reason or another can't be contacted to do that long form interview. This is just one way that we can make sure we get those numbers right down and therefore have everybody not just contacted but actually making a link with those people and getting all the answers to those questions, and then that begins all that other work that Mark's talking about. It's one tool and it's a really good thing to be doing. If I can get you some more detail, I'm more than happy to do that.
You had a post up on your Facebook last night, I think it was, about young people.
Yep.
What type of data are we seeing more infections among young people?
30-40% of cases between the ages of 20 and 29, 18 and 29.
Has that changed at all?
No, that's been a feature right throughout. But when you've got this much community transmission, and again, it was carefully written because it's not about, I'm not their father, I'm not their boss, I'm not their teacher. I'm just putting a really clear message to them and every single Victorian. And it's not about blame, it's just about being as frank as you can. And all of us, regardless of our age, our gender, our postcode, our income level, whether we pray or we don't pray, none of those things matter. We're all in this together. We are all part of, if we're not careful, a chain of transmission that just doesn't end. And we finish up with many more people dying, many people that are chronically ill for a long period of time, and a health system that won't cope. I want businesses to survive, I want businesses to reopen, I want people back at work, I want people finding a COVID normal. We can achieve that, but the government can't achieve it for Victoria on its own. Every Victorian has to play a part in that, and we're grateful to those who are, and we shouldn't because of the bloke at Bunnings or, you know, someone who wants to post on Facebook that they got past a regional Victoria checkpoint or whatever other nonsense that we see. Let's not have that diminish the fact that the vast majority of Victorians are doing a fantastic job, and I'm very grateful to them, and I think that their fellow citizens are too. We've just got to keep that going, as challenging and as frustrating as it is. So, Mayor, I think that's essentially John's question that he asked a little while ago about whether we can be definitive about when these restrictions end or when there'd be substantial easing. I just don't think we're in a position to be able to say that now. Ultimately, that's in the hands of all of us. If we continue to do the right thing, to follow those rules, to make a contribution, and again, the single most important thing to do beyond masks and hand hygiene and cough etiquette and all of those things that we know now, the single most important thing to do beyond that is don't go to work if you're sick. Don't go to the shops if you're sick. Go and get tested if you're sick. That's the only thing you can do. Get tested quickly, stay at home, wait for the results. If you need support, the support is there for you. We will only see a reduction in workplace outbreaks and overall case numbers if we can pull this up in a number of workplaces. Every workplace is important though, but we are seeing a number of outbreaks in many sectors that we've spoken about at length.
Monash University has done a mental health study and found that roughly between 14 and 27% of their respondents, 14,000 people, are experiencing some sort of depressive symptoms. I know you've made some announcements in regards to mental health.
We have.
Are we doing enough? And I mean, 14% of the respondents apparently felt like it wasn't worth living in this period, so it's a concern.
I don't think there are too many politicians in our country that have been as frank as I have tried to be, at least, in terms of the complete inadequacy of our mental health system. It's not a criticism of those who run it, they do their best, but we're having a Royal Commission into mental health for a real reason. This system is broken, this system is not working, this system is not really a system. It's a series of services and they don't connect as well as they should. That Royal Commission's been delayed slightly, but we're implementing the first recommendations that were made to us. A very substantial investment in additional beds, additional support. Minister Foley and I have announced, I'll get you the exact number, but at last count, I think we're up to about $80 odd million in additional funding. It could be more than that. If we have to do more, Mark, we will. We know that this is very challenging for every single Victorian. That challenge will, I suppose, present differently. We know this is not easy. That's why we have to get it over and done with as quickly as we can, and that's why we need people to come forward and get tested, follow the rules, make that contribution, wear that mask. That's how we'll get to the other side of this quicker. You certainly can.
Frustration that they're not being better utilised by the Department of Health to help with, whether it's education or, on the front line of the pandemic. How would you, or do you have plans to better utilise GPs?
Well, firstly, GPs are an important part, an integral part of Victoria's health system. We have been utilising GPs from the start of this pandemic. They're kept regularly informed about the Chief Health Officer's advice through alerts that are sent out to our primary health networks, as well as to GPs directly with the latest advice and information. We do encourage people to utilise their GPs. We're grateful for the fact that we now have access to telehealth, and people can consult their GPs about their regular health needs through that innovative technology. And of course, many GPs are also working with us to offer COVID testing as well, either through their clinic or through other pop-up Commonwealth funded pop-up clinics as well. So we're grateful to GPs for the really important work that they are doing, supporting our community at this challenging time. And can I take this opportunity, of course, to thank all of our dedicated healthcare workers. I am daily in awe of the amazing work that all of them are doing. Back in March, of course, we established the working for Victoria Health Portal, and it's amazing that 16,000 retired or students who are healthcare professionals put up their hand to support their fellow Victorians at this challenging time. So we didn't need to utilise that surge capacity earlier in the year, but we are now deploying many hundreds of healthcare workers and those who are studying for those healthcare professional qualifications to either health services, to testing sites, and also as part of our contact tracing efforts. So I just want to take this opportunity to thank each and every one of those 16,000 dedicated healthcare professionals for the amazing work that they are doing, and to thank all of our healthcare workers for their work, their inspiring work each and every day. They are truly our heroes, and we can support them in their efforts by doing our part and staying home as much as is possible.
Carlos, to what extent is the cold weather, I know this is a bit of a probably more for the show, but
Yes.
what feedback are you getting on the fact that Victoria is clearly a cold state and how that is feeding into the issues that we've got, and whether it's the reason we're worse than New South Wales has a bit or a lot to do with weather?
Yes, look, I am aware that there is some international evidence to suggest that the colder weather, the colder climate can play a part, but I think it would be best that I refer your specific question to the Chief Health Officer for some more definitive advice around these issues. I can say that I'm grateful for the fact that Victorians have gone and had their flu jab this year in huge numbers. We've had far greater numbers this year than we've ever seen before, and that has actually put a downward trend on flu numbers this year. Usually our hospitals are saturated with influenza cases at this time of the year. We are seeing obviously more and more COVID cases now. And can I just say in terms of the numbers today, this is a very high number. We know that the higher the number of positive cases, the more hospitalisations we will see, and sadly the more fatalities we will see as well. And I want to take this opportunity to express my condolences to the 10 families who have lost a loved one in the last 24 hours. My thoughts are with them, and we can all do our part to keep each other and our fellow Victorians safe if we follow the rules.
Just before you do, can I? Jenny's absolutely right to wait. We can get the Cho and others to talk to you about weather patterns and stuff. But I'd just say, look, lest anyone think we're blaming the weather. There's 70,000 cases a day in the United States, and it's stinking hot over there at the moment. The bigger thing, the thing that will drive case numbers up and up and up, is people who are sick not getting tested. People who are sick not getting tested and going to work, going to the shops, going to Bunnings, going wherever they're going. Even if they're wearing a mask, there is still, no mask is 100%. You've got to do it, and it makes a big difference, but it doesn't eliminate risk to that absolute certainty. So the biggest challenge, John's not wrong, I think that there is growing global evidence about colder climates, but the much bigger, by an order of magnitude, much bigger challenge is people who've got this, who aren't getting tested and are going about their business. And again, we're not judging them, we're just simply saying that's got to stop. If your bank balance, if not getting paid for your shift is driving that, then there is a $300 payment available for you, and if you're positive, a further $1,500. That's the best and most meaningful thing that we can do. This will be over sooner if we can really drive down the number of people who are presenting to work with symptoms. That's just a simple, basic thing that we can do. If financial hardship's an issue, well, we've taken steps to deal with that. If we have to go further, then of course we will. And if you've got any examples, Samaya, of any employer who is, making decisions against the interests of anybody who's doing the right thing, I'm more than happy to follow that up, because anyone not going to work because of symptoms or because they're waiting for a test result is actually doing the best of work. They are protecting their workmates, they're protecting all of us. On a non-COVID question.
The Australian Council of Attorney General are meeting tomorrow to discuss raising the age of criminal responsibility.
Right.
Victoria's position on raising the age of consent to
I am prepared to freely admit to you that I was unaware of that meeting and I was unaware that that was on the agenda. But what I will do is I will have our Attorney-General, who is a member of that council, come back to you to clarify our position. Sorry, if I had anything better, more, I would give it to you, but I don't. Sorry.
Sorry, just on another unrelated kind of question, Bob. New cameras to detect drivers doing the wrong thing remotely. What's the advantage of using new cameras? Why does it need the license?
Well, as we see, there are many people who are on their mobile phone. It's like being blindfolded, and well and truly over 0.05 at the same time. That's what all the experts tell us. This is about using the best technology to try and save lives. There will be a trial period, so we have it all proven up, and there's no question that they're working as they should. But once that trial period's over, if you're on your phone, every chance that this is going to pick you up, and you're going to finish up getting a very significant fine.
Do you think that's going to change behaviour?
I think it will. I think that we've all seen recently Victoria Police have made a real focus of this with moving in between traffic, for instance, when traffic's banked up at the lights. A real focus on trying to get people off their phones, because we know it's like driving blindfolded. It's like being well and truly over 0.05, and it can cost you your life or the life of someone else. And then, of course, there's those tens of thousands of people who have lasting impacts of road trauma, injuries and other conditions. Yeah, this is about trying to drive down that road toll. It's trying to make sure that our roads are as safe as they possibly can be.
Just back to it,
Sure.
I've seen a increase in the number of regional areas outside the lockdown area, in particular, landfill in Colac.
Correct. Yes, it's a very significant outbreak.
Yeah, there's some businesses and schools have taken it upon themselves to close down. Do you think the lockdown should be extended outside the Melbourne area?
Any changes that are made would only be made on advice. I have no such advice. That particular workplace, it is a workplace-based outbreak, and there's a really concerted effort, a significant team of people that are working to support that business, its workforce, the local town, Colac Health. It's a very significant challenge, but one I think that we're equal to. I understand there's a whole lot more testing going on today. If there's anything further I can add, I will, but that is by its very nature an outbreak, a known and contained outbreak, as best you can ever contain one of these things. That doesn't speak to community transmission, for instance, or a whole lot of unknown cases right across regional Victoria. Those numbers remain low, but perhaps if we end here, unless there's any other questions, regional Victoria, it's not like there are no rules in regional Victoria. There are still rules. They're different to the rules in Melbourne, but they still have to be followed. So if you can't maintain distance, can't maintain that 1.5, we're asking you to wear a mask. Many people in country Victoria are doing that, and that's a really significant thing. If you're sick, you've got to go and get tested. If you're sick, you shouldn't be going to work, the shops or anywhere else. That applies across the whole state. There are rules about gatherings. There are all manner of different rules. If everybody follows those, whether you're in the southeastern suburbs of Melbourne, a big regional town or the smallest country town, then that's how we'll get to the other side of this with the most favourable set of rules quicker.